Okay, so we'll start with blood pressure. So once I get everything on, then I would listen to when Kate's heartbeat disappears, and then I would add 30 millimeters mercury to that. So when I start to air it up, I'm going to put hers at about 150. So first I'll go ahead and get this on, and then we just want to make sure that the arrow is pointing down towards her artery here. Let's see if I'm not struggling. There we go. Okay. So we'll tuck that under there. It'll stay. Okay, and then I'm going to use the diaphragm side of the stethoscope right here. And then since she's sitting down, I just want to make sure to hold her arm up about heart level, and then make sure she's relaxed as well. So I get these in here. So I'm going to make sure she's relaxed, and then air it up with my, well, let's see if we can get this out of the way. I don't struggle through this. Okay, so we're here. So air it up. You get to about 150, and then I'll slowly release it. And then just listen to when I hear the first sound, and then that will be her systolic. And then when that sound disappears, that will be her diastolic. So Kate's pretty normal, about 120. And then next, so we'll do heart rate now. So for radial, I would just take Kate's hand and then use my index and middle finger here, and then just listen. And for the most accurate results, you would want to do a full minute, but you could also do 30 seconds and then take that times 2. But if she had an arrhythmia, I would want to take it for the full minute there. And then for carotid, I'll do scoot over. So for carotid, I want to go just medial to that sternocleidomastoid and below the jaw here. But then I'm going to use my index and middle finger again, making sure I'm not pressing too hard. If you apply too much pressure, then she could pass out. So just right there. So then next, for the ankle brachial index, I would do the systolic blood pressure of the ankle divided by the systolic blood pressure of the brachial artery in the arm, and then I would just use that to determine if they had peripheral arterial disease. So next, the auscultation of the heart sounds. So I'll get my stethoscope. So I'll kind of just show these to you first. So with the stethoscope, making sure that your pieces are pointed forward, and then for the diaphragm side of the stethoscope, that's here. And then you're going to use that to listen to higher pitched noises and then apply firm pressure with it as well. And then we can flip it around and use the bell side of the diaphragm for more low pitched noises, and then you just want to apply like a light pressure when using it. So when auscultating, I'll flip this back around. For the for the 4 areas you have on your right side up here, about the sternal angle, you have the aortic, and then if you go over to the other side on the left, you'll have the pulmonary. For tricuspid, I'm going to go about right here, and then mitral, you're going to go just below down here. So S1 sounds are going to be heard best at the tricuspid and the mitral with the diaphragm side, and then S2 will be aortic and pulmonary with the diaphragm side. So then if we flipped it and used the bell side, you would want to do that for S3, S4 sounds at the mitral location. And then murmurs you could hear at all four placements, and then you can use the diaphragm or the bell side of the stethoscope. And then and then the last one is going to be the brutes. So I'll go ahead and demonstrate those on Kate. Let's go over just a minute. So we're going to do a carotid brute. So I'm going to use the diaphragm side of the stethoscope and place it over her carotid artery. And then once I get there, I'll have Kate hold her breath so I can listen to one. So if I go here, again, not giving too much pressure. Okay, go ahead and hold your breath. Okay, and if she were to have a brute, then I would hear like a blowing noise, but she doesn't have a brute, so that's good. And then on the murmurs, I forgot to say, if I could hear one of those, it would be kind of a swishing noise. So then, okay, now we'll move to the breath sounds. Oh, focus on this again. So at first, okay, I'll go ahead and have you stand up.
Yeah.
So this might be easier to see. So I'll do the anterior working down first and then the posterior sides. So I would have her take a deep breath at each site. I'll just have her do that for the first couple of times. But for the upper lobes, we're going to start up here. I'll flip this around. So I would start on Kate's right side here, and then I would have her take a breath. And then I'll go here, have her take a breath. And then I would have her take a breath at each spot, but just to walk through the lobes. So these top two up here, we'll be listening to the superior lobes on both sides. And then we can come down and do the same here for the superior lobes. Now the next one, if I move down on the right side, we'd be listening to the middle lobe. But on the left side, it'd still be superior. And then we'd work down to the inferior lobes on both sides. And then again, down here. Now if we did the posterior, we would start up here again on the left side. So these will just be the upper lobes and then the lower lobes. So here, I would have her take a deep breath, upper lobe, and then upper lobe, upper, upper, and then we'd start with the lower lobes once we get here. And then go all the way down. Okay, and then next we have normal breath sounds. So for the normal breath sounds, the bronchial breath sounds would be heard at the trachea best. That's where they are normal. And then for the bronchiovesicular, those are best heard in the upper third of the chest or between the scapula, between T3 and T6. And then the vesicular noises are most commonly heard at the bases or the periphery of the lungs. So next we'll do airway clearance. So I'll have Kate lie on her stomach, and then I'm going to place this below your chest here.
Doesn't matter where my head is.
Yeah. So here we're draining the superior segments of the lower lobes. So I'm going to put this below here. And then I'll perform percussion on her for 30 seconds. Let me make sure you can see Kate well though. There, that is good. Okay, so I'm going to perform I think that's long enough. And then, yeah, I'm going to set up. So for the next, I'll just go ahead and teach you the ACBT. So first, you would want to teach them diaphragmatic breathing. So place a hand on your chest and then one below on your stomach here. And then you want to tell them to breathe in through their nose, but make sure they're feeling their stomach moved and then their chest doesn't. So breathe in and then breathe out. So just making sure that the hand on their stomach is moving and then the one on their chest is not. And then we would go to chest expansion. So you put your hands around the lower parts of your ribs. And then again, breathe in through your nose and you want to feel that lower part of your ribs expanding. That wasn't a great example, I'll redo. again, just making sure they're feeling it expanding down here. And then the last part is a huff. So you're going to tell them to take a deep breath in, just filling their lungs as much as they can, and then when they blow it, they're going to make a noise, kind of like a huff. So you would, I think that was okay. Kind of noise there. And then for next, we'll do breathing exercises. So for pursed lip breathing, you're going to have them inhale through their nose a couple seconds, and then they're going to kind of purse their lips up like they're whistling and blow out through them. So inhale for about 2 seconds and then exhale for 4 or 5 seconds there. And then you'd want to use that to relieve dyspnea or dyspnea. So then, again, for diaphragmatic breathing, you would place hand on the chest and then the stomach, and then when you're breathing in, just watch for the hand on the stomach to move out, and then the one on the chest to stay there. And then you would use diaphragmatic breathing for like hypoxia, atelectasis, and then tachypnea or tachypnea around there. So just some of those things. You could use it for anxiety as well. And then the last one, we have the pace breathing. So this is, you would want to use this for more like low endurance activity, fatigue, or like this dyspnea with exertion and stuff. Similar to pursed lip breathing, you just want them to inhale for a count, so 2 or 3 seconds, and then purse your lips and breathe out there. Just kind of pacing yourself and counting when you breathe in, and then counting when you breathe out there. And then I think that's all.